Hello, everyone. Welcome to That Expert Show, where you help run the show. I'm Anna Canzano, and this is a special edition of our show. For those of you who might not be familiar, I do this show in partnership with The Oregonian, and it is a little different because you do get to run the show. You ask the questions, I turn around and ask those questions of the experts that I feature as my guests. And we figured that with the coronavirus being discovered here in the Pacific Northwest this weekend, and all of the concern and some relative levels of uncertainty about it, it would be a good time to bring in an expert guest. We all saw the long lines at grocery stores and Costco's this weekend throughout the area as people were trying to stockpile their supplies for what could be a quarantine. But we want to dispel any myths. We want to, knock down any misinformation out there. Joining us live is Dr. Paul Cieslak, who is the medical director of Communicable Diseases and Immunizations with the Public Health Division of the Oregon Health Authority. Dr. Cieslak, thanks so much for taking time to talk with us.
Thank you for inviting me.
We are just getting word this afternoon that sadly the death toll for the U.S. in terms of the coronavirus is now up to 6, and all 6 of those deaths have occurred among residents of Washington State. Is that what I understand?
Yes, that's correct, unfortunately.
How concerned are you about the community spread of this disease? And, frankly, we know being in Oregon, we are not far from Washington, and there is extensive travel on I-5 and other highways between our two states.
Yes, we're indeed concerned about this. The fact that we have now identified our third case and this last one in Eastern Oregon, a resident of Umatilla County, suggests to us that the virus is getting around. It's out there in the community. And of course, the hospitalizations and the fatalities testify to its potential severity.
And just as a review, we also discovered, right, as you said, over the weekend, a case of a Lake Oswego elementary school employee with confirmed coronavirus. Has that case, that was presumptive initially, has that been confirmed by testing through the CDC?
No, it hasn't. Our state public health laboratory just got the capacity for testing on Friday, and they ran this specimen Friday, and it turned out to be positive. We've since found 2 other positives in the state of Oregon, but they all need to be confirmed by confirmatory testing at the Centers for Disease Control, and until then, we'll consider them presumptive. But we are treating the presumptive cases like real cases.
And to be clear, the second case that was discovered was described as someone who was a household contact of that Lake Oswego elementary school employee. The third case is the one that you mentioned in Umatilla, who doesn't appear to have any connection to the folks in Lake Oswego. That is worth noting that Umatilla County is seeing a case. That really speaks to how this disease is widespread and doesn't really have geographic boundaries.
I think that's correct. At this point, the virus has proved its ability to get around, and we would test persons from any part of Oregon who presented with a serious respiratory illness without another diagnosis.
So help me understand, because there's also been quite a bit of information out there about what symptoms to actually look for. There have been comparisons to the flu. Obviously, the numbers for influenza and the death rates for influenza lend some perspective to what's happening with the coronavirus. But what are the symptoms that people need to watch for and that they might suspect they have coronavirus?
Well, I do think there are a lot of similarities to influenza. We don't have all the information yet on the spectrum of illness that this coronavirus can cause. But as far as we know, it does look similar to influenza. The symptoms to watch for would be fever, cough, and shortness of breath. There may be a lot of persons with milder illness who don't get short of breath, for example. But remember that with limited testing capacity in the United States, we've been testing people who tend to be pretty seriously ill. So we find cases in really seriously ill people, and that's who it's most important to test. But there are probably milder cases out there as well.
Can you help me explain that limited testing capacity here in the U.S.? How dire is that situation, and how concerned should we be that, the state only got the testing kits last Friday?
Yes, it's pretty significant. We certainly wish that we had the ability to test previously. Perhaps we would have found cases earlier. We're very glad that we can do it now, and we have the capacity to run about 80 tests a day, which is a lot. At this point, we're not expecting a requirement to do more of it. But the ideal situation would be when the methods get distributed and validated by commercial laboratories, and your regular hospital laboratory that tests you for everything else can also test for this new virus. That would be ideal.
Based on what you've seen with how this virus is behaving and your knowledge of communicable diseases, how do you see this playing out, Dr. Cieslak?
To be honest with you, we are not very good at stopping respiratory viral diseases for which there is no vaccine. When we have a vaccine, we're a lot better at it. The classic example would be measles or rubella. We're not as good at stopping things like the common cold. But we do think that the same measures that could reduce your chances of getting the common cold or influenza or any of these other diseases are similar to what would prevent the spread of COVID-19. So, stay home while you're sick. That's probably the most important thing, because if you're out there coughing on people, you're going to spread it to other people. Wash your hands frequently or use an alcohol-based hand sanitizer. Other things that you can do would be to, disinfect, clean, frequently touched surfaces like doorknobs, maybe keyboards. If you share things with other people, don't share glasses or eating utensils. And the other thing that we want to make sure that everybody knows is be sure that you have a plan and you have prepared for the possibility that you might have to stay home for a couple of weeks. If you get sick and need to stay home, do you have everything you need? Your food, your supplies. If you need medicines, do you have a 2-week supply of those things?
Isn't part of the challenge with this virus that the so-called incubation period is as long as 14 days? So is it true that you could contract the virus, be a carrier, not present any symptoms, and actually be spreading it to other people for as many as 14 days before you become symptomatic?
Well, again, we haven't been testing a lot of people who don't have symptoms. We test them after they develop the symptoms. So there's a bit of guesswork involved with how long before they develop symptoms they have virus on board. Now, when the virus is incubating, they have the virus, but they may not be capable of spreading it to anyone. So it may be, for example, in their bloodstream, but not in their nose and throat and saliva, where it could be spread to other people. We don't think people are likely to be very contagious before they develop symptoms.
Interesting. And again, to refer to the 3 cases that we know of in Oregon, the presumptive cases, none of those 3 people had traveled to China, had contact that they knew of with someone who had traveled to China.
That's right. And that's what suggests to us that in all likelihood, they got it from someone in the community that they didn't know had this infection. And remember, in the early stages, when the outbreak surfaced in China, we were testing people who had just gotten back from China. At some point, it arrived in the United States, apparently, and now that we're finding cases that suggest community-based transmission, we know that it's out there.
I've seen numbers that seem dramatic, and perhaps you can help dispel this myth if it is indeed untrue, that if you were to take the death rate of what the coronavirus is doing in China or has already done, we've topped 3,000 deaths now worldwide, that the numbers could be as high as 350,000 deaths in the U.S. based on the current population?
I haven't done the math to calculate this out, but if there's a comparison to influenza, remember that CDC has estimated that influenza kills about 23,000 people every year. We have influenza circulating in Oregon right now. So that's a thing to be concerned about. But remember that the tests that have been conducted on this coronavirus have tended to be on the most seriously ill people, so that we can say something about the death rate when you're hospitalized with it, but we can't say much about the death rate when you haven't been hospitalized with it. With influenza, 3 to 5% of people hospitalized with it will succumb, will die of the influenza. And I don't know that this COVID-19 is much different from that.
I see. And yet, as you pointed out, the difference is that with influenza, we do have a vaccine against it, and with coronavirus, thus far, we do not.
That's correct.
Okay. Part of this show is that we invite people from the audience to submit questions, and they are doing that. I'd like to submit some of the questions to you and see if you might provide your expertise. Jamie, for example, on Facebook wants to know, are there additional precautions the elderly and those with underlying health conditions should be taking?
Well, we're certainly wanting to reinforce the basics of stay home when you're sick and wash your hands frequently. There are specific travel precautions that the Centers for Disease Control has made are for people who are older who have underlying medical conditions that put them at higher risk. I mean, they recommend that such persons avoid any non-essential travel to, China or Japan or some of these other countries where the virus is actively circulating. But if you're concerned, I think you might, limit your direct contact with other people, which is not to say that, you can't have people at home, but you may not want to attend any big gatherings, or you may want to be particularly attentive to washing your hands after attending any such gathering like that.
Interesting. And Kevin wants to know, regarding the Lake Oswego situation, who were the local health officials who determined that this was a low risk to staff and students?
Well, when we get a case like this, as when we get a case of any reportable disease, the local health officials try to trace backwards and say, who has this person been exposed to, and who might this person have exposed? And they made their conclusions based on that investigation. It appeared that there was not a lot of direct contact between this person and others at the school.
Okay. Part of the information that I think the district in Lake Oswego sent out, the school district, was that there was a level of review that the CDC conducted, and something about expanded surveillance. What exactly would expanded surveillance entail? This person wants to know.
Well, surveillance is testing people that, surveillance can be just compiling the data on the people that you do test, but expanding it would mean doing a lot of testing beyond what you would normally do. I think we've done a little bit of that because we've kind of bent the rules a little on whom we're going to test, and we've been getting a lot more specimens because of that. But I think some people have asked the question, should you be testing everybody who was in the school? And we did discuss this issue with CDC, and we gave it a lot of consideration ourselves. But we think, first of all, that the likelihood of finding additional cases in people without symptoms who were apparently minimally exposed, if at all, at the school would be a lot of effort and not very fruitful. Moreover, it's not an easy thing to collect a specimen according to the Centers for Disease Control guidelines. They would like such specimens collected in a place that has airborne precautions, because you can generate a lot of aerosols if you're coughing while the specimen is being collected.
Absolutely.
So both for reasons of low likelihood of finding much and for reasons of testing practicality, we considered, and we did run this explicitly by the folks at CDC who said, we wouldn't go this route, and they didn't want to try to send a team of people out here to do it either.
Interesting. Okay. We had somebody, we're talking about the schools, talking about kids. Amanda on Facebook wanted to know, if little kids and older kids too, thankfully, don't get the virus, or they at least have not succumbed to it as much, why did schools in Japan close? Is it because kids can spread the disease?
Well, I think that's the rationale. I mean, because kids tend to have less immunity to viruses and bacteria than adults do. You know, they haven't had as much time as we have to build up immunity to all the hundreds of different viruses out there. Often you'll find viruses spreading among daycare centers or school children, where they would have less likelihood to spread among adult populations. So I think that was the consideration. Kids tend to be healthier than we are when you get to be my age, for example, and any given infection is less likely to land them in a hospital. So it's possible that they could have illness and be spreading it to each other without appearing to be very, very sick. So I think that was the rationale that Japan used. We don't have any data on that at this point. We haven't tested many kids. We don't know whether we're not seeing it in kids because they're not getting it, or because they're getting it but not getting sick from it. We have not thought it necessary to pursue those sort of extraordinary measures here in the United States.
Yeah, but it's definitely on the minds of, a lot of parents. We had kids, this weekend that we kept home from some group activities like gymnastics classes, and we avoided going to church this weekend just because it was one of those things where we said as a family, well, if there are some minor things we can do to adjust our schedule and reduce our exposure to group activities for now, unless we know more, we have the option of scaling back. But we did send the kids to school today because we were watching the information come out and felt comfortable sending the kids to school. But it's definitely on the minds of a lot of parents. There's a parent that I know who wanted to know, what is the most effective way to prevent the spread without killing off healthy bacteria?
Well, again, it's a virus. We don't have any specific antiviral medications that have been proved to work against this. So it's not like we're recommending that people take an antibiotic that would kill off their bacteria. We're simply recommending that they try to reduce their exposure to any viruses, that are in other people's nose and throat and mouths. So those measures are not going to kill off your normal bacteria.
Okay.
And the alcohol-based hand wipes, are going to have they're going to kill some bacteria off the skin, but you don't need bacteria on your skin as much as you need them in your intestines, for example, where they perform an absolutely crucial function.
We've certainly seen a run on sanitizer at the stores along with other products. When you go to buy soap to wash your hands at home, does it matter that you're buying antibacterial soap, or will any soap do?
We think any soap will do. The most important thing is to wash the bacteria, the viruses, down the drain. And so, washing your hands with soap under running water for 20 seconds should do the trick. When they've done experiments with bacterial counts, you do find that you can reduce bacterial counts further by using an antibacterial soap. That may provide some marginal level of increased protection, but we think the main thing is washing with soap and water for under running water for about 20 seconds. And if you don't have that available, using the alcohol-based hand sanitizers, which will kill many viruses, not all, but many viruses and most bacteria.
And Dr. Cieslak, we're here, March 2nd, just starting the spring season, if you will. Based on what we know about the flu, it tends to dissipate as the weather gets warmer and people aren't congested in rooms with each other and sharing airspace. How do you see coronavirus playing out here in the months to come?
Well, I always get into trouble when I try to make a prediction about this, but it's true that there is kind of a respiratory virus season. The Centers for Disease Control has been telling us for some time now that the goal, they didn't really have a a lot of optimism about being able to keep the virus completely out of the country, but the goal was to slow its introduction. And I like to think that if the virus has to hit us, it would be better for it to hit us, later in the spring than during the peak of the winter months, during the respiratory virus season. So maybe, we'll see less severe illness or less illness overall if it hits us later rather than earlier.
And is it one of those viruses that will, say, go dormant as the weather improves and then resurge again in the fall once the weather turns cold once again?
Well, too early to tell, but that is the way that most of these respiratory viruses behave. They don't really go dormant, but they circulate at lower levels. And then when the right conditions arise again, they ramp up their circulation. It becomes easier for them to spread.
Someone on Facebook specifically wants to know, is Oregon planning on protecting those over the age of 60?
The same, as I said, the same measures that will protect those over 60 are going to be the ones that protect everybody. And it has to do with, reducing your contact with other people and reducing the possibility of spreading any disease that you have by staying home, hand washing, all that. There's no difference at this point in the measures that we would undertake to protect young and old.
And does boosting your immunity with things like, dropping an airborne tablet into your water in the morning right now, having your kids take a vitamin C tab, does any of that help ward off an illness related to coronavirus?
Unknown, not known to do that.
Okay. On Twitter, someone wants to know, well, they understand that it may be possible that toilets can distribute the virus in the air. If so, are bleach tabs helpful to prevent this in public restrooms? Is that true?
Well, that's an interesting question. We don't think that transmission through feces is a major route. This is of transmission for COVID-19. This is a respiratory virus. It tends to be present in high numbers, at least easily detected numbers in the secretions of the nose and throat, and then obviously it gets into the lungs. And we think that that's the easiest way to spread it to people. So coughing on someone, sneezing on someone, putting your hands to your mouth or nose, and then shaking hands with someone who then puts his finger to his eye and inoculates himself. Those are the mechanisms whereby we think most respiratory viruses go from person to person. So I will not be buying any bleach tabs.
Okay. And Dr. Cieslak, Tanya on Facebook is hoping that you can address the purchase and appropriate use of masks and cleaning supplies. We've heard about the run on masks and how hospitals are concerned that there won't be enough masks to go around for the people who are actually sick versus the people who just want to wear them as a form of protection against others. Who should be wearing masks? Tanya says she knows it isn't currently advised, but she would imagine the government pages for those being treated with cancer, transplant patients, and such, probably should be wearing those masks in public places?
Yes. For the general public, you're right. We do not recommend routine use of masks. We think it provides very little additional protection. Now, if you have an illness and you're coughing a lot, it would be better if you had a mask on and were coughing into the mask than you be, coughing on the person who's sitting next to you on the bus or the train. So it may provide some protection if used by the person who has the cough, but not by the person who's being coughed on. If I get coughed on, it doesn't necessarily need to go directly into my nose or mouth in order to infect me. It could go on, onto my hands or onto my face, and then I inoculate myself somehow from there. We are concerned about the supplies, especially within healthcare facilities. You're right that people with immune system compromise in the hospital often have to have, masked people coming in to meet with them so that they won't, so that they'll be less likely to be exposed to any diseases. And it could become a real issue if we have lots and lots of patients with those kinds of diseases. CDC has made some recommendations about extending the life of masks, using them for longer periods of time. They have expiration dates on them. Will they still work after their expiration date? Well, CDC and I believe FDA did some studies that showed that most brands of masks, not all of them, will work beyond their expiration date. So that's good news. And after that, we're going to have to depend on supply chains to step up and meet any additional demand.
Well, supply chains that are derived from China, which is still in an economic standstill in large part. Tanya has a couple of follow-up questions that I think are interesting. She's talking about people who wear glasses but don't realize they should be cleaned regularly. Many people have purchased protective eyewear and goggles, yet they might not know how to clean those as well. Can these type of items be reused? And if so, what is the best practice for reuse?
Yes, they can. I don't know that we've developed any formal guidance on reusing them, and you're right. They could be coughed on and virus gotten on the outsides of them. There are a variety of disinfectants which will kill norovirus. I don't have a complete list with me, but something that you could use to clean other surfaces like Lysol would work for these things. One good thing to know is that a dilute bleach solution will kill just about anything that might infect you. And that's a good thing to know. To be honest with you, though, I don't know how well that would work on my glasses. But for other surfaces, it works very nicely. So, the bleach wipes that you can buy are very effective on surfaces.
Yeah, it's so hard with this because, obviously I've covered all sorts of outbreaks in the past as a journalist, covered norovirus outbreaks on cruise ships. And we want to try to calm the public down and say, hey, this is not worth going chaotic over. And yet there is a balance to be struck between being prepared, being knowledgeable about what's happening, and then not going to the extreme of, living every day with anxiety about what's happening.
Right. I'm here every day with a bunch of colleagues at the Oregon Public Health Division, working on addressing this outbreak. There's a lot of people hanging around, and could one of us infect another? Sure, but we're still going to come to work. We have half jokingly, half seriously, but we're not shaking hands anymore. We're kind of giving them the elbow bump just to try to do what we can to reduce the contact. But I think most people should go about their lives, and then if the health department calls you up and says you've been a contact, then you're going to need to be more concerned about it.
All right, Dr. Cieslak, thanks so much for taking the time to answer our questions this afternoon.
Thanks, my pleasure.
And thank you for joining me for this special episode of That Expert Show. I hope we got to most of the questions that you had. Feel free to submit them still via social media if you have them. I can always contact the Oregon Health Authority and reach back out to Dr. Cieslak and see if he will answer those questions online. You can reach me on Facebook, Twitter, and Instagram at Anna Canzano. You can also go back and watch this episode or share it with others from our website, thatexpertshow.com. We are also on YouTube, and we put all of our shows out to you as podcasts as well on Apple iTunes and Google Play, Stitcher, Spotify, TuneIn, all of those good places. We will create a tip sheet based on this episode so that you can share this information more easily with others. And again, if you're interested, you're welcome to join my show every Monday at 11 a.m. right here on Facebook. It is called That Expert Show, where you help run the show.